Good morning, everyone. Today, we begin our exploration of environmental and occupational health sciences, a field that sits at the intersection of science, public health, and human well-being. Over the next hour, we will move through the key concepts presented in your slide deck, but I will guide you through them in a way that feels more narrative, connected, and practical. Let's begin. Environmental and occupational health sciences examine how physical, chemical, and biological surroundings shape human well-being. At its heart, this field asks a simple but critical question. How do we protect people from the environments they live and work in? Our mission is prevention, preventing disease, disability, and premature death. But achieving that requires a network of systems: monitoring, early warning, emergency response, public education, and long-term planning. Think of it as a safety net woven from many threads. When even one weakens, the entire community becomes vulnerable. Environmental health focuses on the interaction between humans and environmental hazards. The goal is straightforward: monitor conditions, control risks, and reduce exposure. History gives us powerful lessons. For example, coal workers in the 19th century frequently developed lung disease long before we understood the dangers of particulate matter. Those tragedies led to today's strict air quality standards. Modern priorities now span a wide range: ensuring breathable air in rapidly growing cities, maintaining safe water and sanitation systems, removing or preventing lead contamination in homes, setting occupational limits for chemical exposure in factories. Each of these reflects the same principle. When the environment is unsafe, health suffers. Public health serves as the bridge between environmental conditions and population wellness. This work requires cooperation across disciplines. Engineers design systems, toxicologists assess hazards, and policymakers develop regulations. Public health teams monitor the quality of air, water, soil, and industrial emissions, use wastewater systems to detect early signs of disease outbreaks, communicate risks effectively, such as during contaminant spills or PFAS alerts. The strength of these collaborations determines how quickly and effectively communities can respond. To manage hazards, whether chemical fumes, agricultural pesticides, industrial noise, or airborne pollutants, we apply the hierarchy of controls, a structured method for reducing risk. Substitution: replace dangerous chemicals with safer alternatives. Engineering controls: improve ventilation, redesign equipment, create barriers. Administrative controls: rotate workers, limit exposure time, modify workflows. And PPE: gloves, respirators, face shields, and protective suits. For example, a printing factory might replace a toxic solvent, substitution, install exhaust hoods, engineering controls, schedule shorter shifts, administrative controls, and finally provide respirators when necessary, PPE. Environmental surveillance is a continuous cycle of collecting data, analyzing risks, and acting on findings. It involves sampling, testing air, water, and soil, assessment, comparing results to safety standards, and intervention, issuing restrictions, cleaning contaminated sites, or rerouting water supplies. A contemporary example is wildlife surveillance for zoonotic diseases, monitoring bats or rodents for viruses that could spill over into humans. Disasters: floods, earthquakes, storms often damage sanitation systems. When sewage pipes rupture or latrines overflow, disease can spread quickly. Rapid actions include deploying mobile latrines, designating emergency waste disposal zones, and carrying out immediate vector control targeting mosquitoes and rodents. The goal is clear: interrupt disease transmission in the chaotic days following a disaster. Safe drinking water becomes an urgent priority after disasters. Authorities must inspect temporary water sources, trucked water, boreholes, improvised wells, and ensure proper chlorine levels. Pre-established contingency plans help communities respond quickly to pipe bursts, flood-related contamination, reports of unusual odors, or discoloration. Equally important are public notifications, which ensure communities know when to boil water, when to avoid it, and when it's safe again. Communities rely on two major water sources: surface water, rivers, lakes, and groundwater, wells or aquifers. The treatment process follows a predictable sequence: coagulation, sedimentation, filtration, and disinfection. Each stage removes a different category of contaminants. Meanwhile, wastewater must be safely collected and treated. When septic tanks fail or treatment plants become overloaded, contamination can spread through soil, water, and even crops irrigated with polluted water. In emergencies, shelters provide temporary refuge, but beyond basic sleeping space, they must address the needs of vulnerable groups: infants requiring clean water for formula, people with mobility limitations, individuals with chronic illnesses who need regular medications. The objective is not just survival, but dignity, ensuring that everyone maintains access to essential services without added hardship. Food defense aims to protect against intentional contamination, while food safety focuses on unintentional or accidental contamination. Key practices include keeping foods out of temperature danger zones, preventing cross-contamination between raw and cooked items, enforcing hygiene standards among food handlers. These measures prevent both deliberate tampering and everyday foodborne illness. Large-scale feeding operations, such as during disaster relief, require strict organization. Food must be prepared in clean, centralized facilities and distributed efficiently. Critical concerns include safe disposal of food waste, preventing vector attraction, such as flies or rodents, adequate staffing to avoid lapses in hygiene. When systems fail, thousands can fall ill simultaneously. Food safety systems rely on active surveillance, including investigating clusters of foodborne illness, testing surfaces, cutting boards, utensils, and equipment, confirming proper food storage, cooking, and serving temperatures. Swift corrective actions prevent small mistakes from becoming outbreaks. A well-planned shelter must be accessible, physically safe, and situated away from environmental hazards, like flood zones or industrial sites. Staff have multiple responsibilities: monitoring resident health, providing mental health support, watching for signs of communicable disease. Shelters must be inclusive, ensuring disabled and vulnerable individuals receive proper care. Basic physical requirements include minimum living space per occupant, proper lighting, temperature control, reliable utilities, power, water, sanitation, structural safety, and engineering controls. These features maintain both comfort and health. Crowded shelters faced increased risks of respiratory infections, diarrheal diseases, vector-borne illnesses. To prevent outbreaks, staff implement active disease surveillance, rapid case reporting, and isolation areas for sick individuals. Emphasis on hygiene, masking, and hand washing are key for preventing diseases in this setting.
Cholera spreads through contaminated water and poor sanitation. Effective control requires continuous chlorination of water sources, safe disposal of human waste, rigorous hand-washing promotion, rapid identification and isolation of suspected cases. Breaking the water-feces-mouth cycle is the key to stopping transmission. Typhoid spreads primarily through contaminated food and water. A unique challenge is the existence of chronic carriers, people who continue shedding the bacterium without symptoms. Controls include strict food handling restrictions, safeguards for water supplies, hygiene education for both staff and communities. These pathogens are highly contagious and thrive in crowded, low sanitation environments. Effective measures include intensive hand hygiene campaigns, ensuring safe latrine access, vaccinating against hepatitis A where appropriate, rapid isolation of symptomatic individuals. A functional shelter needs a safe, hazard-free location, adequate infrastructure, power, showers, waste disposal, a layout that supports health services and privacy, clear operating procedures for residents and staff. This ensures operational efficiency and reduces health risks. Shelters and camps can attract vectors such as mosquitoes, rodents, and flies. Control methods include installing window screens, removing waste and standing water, applying targeted insecticides, maintaining clean surroundings. Reducing vector populations directly lowers the risk of vector-borne diseases. PPE protects workers handling hazardous tasks. Depending on exposure, it may include respirators, gloves, face shields, full-body protective suits. Proper fit, routine maintenance, and safe disposal are necessary to ensure the equipment actually protects its wearer. Interventions take two forms: structural, building water systems, improving sanitation, upgrading infrastructure, and behavioral, teaching hand washing, promoting safe food preparation. Community engagement is essential. Lasting change requires local ownership. Cross-sector partnerships, health agencies, engineers, community leaders drive long-term success. Integrated Pest Management, or IPM, uses multiple strategies: cultural, keeping spaces clean to remove pest habitats; physical, placing traps and barriers; biological, introducing natural predators; chemical, using pesticides only when other methods fail. IPM aims for effective pest control with minimal health and environmental risk. Managing human remains during disasters must be done with dignity and respect. Health workers must follow strict contamination protocols, use appropriate PPE, and coordinate with legal and security authorities. Proper handling protects responders and maintains community trust. To conclude, environmental and occupational health sciences exist to protect populations by managing environmental hazards. Through sanitation, disease surveillance, food safety, water systems, vector control, and shelter safety, communities become more resilient. Emergency response provides immediate protection, while long-term interventions create stable, healthy environments. Together, these systems form the foundation of strong public health practice.